Dr. Helen Riess M.D. is a renowned psychiatrist, researcher, and thought leader in the field of empathy and relational science. She is an associate clinical professor of psychiatry at Harvard Medical School and the director of the Empathy and Relational Science program at Massachusetts General Hospital. With her groundbreaking research on the neurobiology and physiology of empathy, Dr. Riess has demonstrated that empathy is a teachable skill, leading her to develop evidence-based empathy training programs for healthcare professionals. Dr. Riess is the founder, chief scientific officer, and chairperson of Empathetics, Inc., a company that provides web-based empathy training designed to improve interpersonal communication and patient care outcomes. Her work has been featured in many prestigious outlets, and she's also the author of The Empathy Effect, the 7 neuroscience-based keys for transforming the way we live, love, work, and connect across differences, which explores how empathy can transform relationships and society. Looking at this now, I think Dr. Riess is probably the first guest I ever should have had on the show. Like I talked about improving empathy, because the research that has been done is incredibly interesting, I found anyway. So thank you so much for joining us today. I've got a heap of questions, so I want to dive straight in if that's okay. I wanted to take you back a little bit, just to your formative years, to understand what helped create the person that's been kind enough to join us today.
Well, I think my interest in empathy was not exactly a formed interest, but I was raised in a family where my parents came from a traumatic World War II experience and came to the United States, and the effects of the trauma they went through were very apparent to me. And also, I had a younger sibling who had some serious medical issues in my early childhood. And so I think the empathy, the caring, and the concern were just, were hardwired for that. And I felt it deeply. And I also saw that when even children on the playground were lacking in empathy and were bullying or making fun of others, it caused a lot of distress to me. So I think a lack of empathy is really what drew me into, becoming a doctor and then choosing psychiatry, where I find that the emotional experience of people is the most interesting thing that we can really do to help people. And so I think that arc is what led me from my childhood to what I decided to do as a profession.
Did you always feel called towards psychiatry in your sort of medical career?
Actually, no. I loved taking psychology courses in college,
Mm-hmm.
but when I started medical school, I really was thinking I would do general medicine. And very early in that experience, one of the first courses we took was a psychiatry course. And I just couldn't stop reading. And the other material was interesting, but I really felt drawn to understanding the mind and also the neurobiology, how the brain works and how we experience emotions.
And in the research that you've done into neurobiology, particularly related to empathy, it's a big question, but what were the findings? What does the brain look like? What does the brain do? How does the brain operate when we're in a state of empathy? If that's the right question.
So, the most exciting part of my empathy journey was when a lot of neuroimaging studies were being done to examine what's happening in the brain.
Mm-hmm.
For instance, when we see people get cut with glass, so like they would show videos to people in scanners, and also so they would see where the pain centers light up when they see other people in pain, and also there were some experiments that where marriage partners were brought into a lab, and the people in the scanners were just told that after getting painful shocks to their hands that their partners had received similar shocks, and just by knowing that somebody they loved was getting hurt, the same pain centers were lighting up, whether they received the shock or whether they just knew somebody else was receiving the shock. And so that was the first evidence that we feel pain when other people are experiencing pain. So that figure of speech, I feel your pain,
Mm.
is not just a glib acknowledgement. We actually feel something. And that empathy, that shared experience, is when everything's working right, it's what motivates us to help. So when we sense other people's pain, we're in a state of disequilibrium, so that we want to get back into feeling okay. And by helping, we feel better.
And in that experiment, the husband and wife, and obviously this close relationship there, does the does our ability to empathize decrease depending how far away? So what I'm saying is, if you had the experiment said, oh, a person in a different state is feeling pain now, would that still register on the brain, or is it your inner circle you're able to empathize with, and as you get further and further away, empathy is less visible?
That's a great question. So we have the most empathy for people who we are close to, where we
Mhm.
can see their facial expressions, their posture. And then that ability to sense their pain is quite acute. But we also have a great ability to empathize with people who have suffered in similar ways. So if I were on a phone call or a Zoom call with somebody in a foreign country and they were telling a story that was similar to something that I experienced that was painful for me,
Mm.
that resonance happens just by hearing somebody else's story. But the farther away we get, and this is why, sometimes when there are floods or fires in very remote parts of the world that we're not really exposed to, um, there's sometimes less empathy. But if you see a fire like the ones in Los Angeles right now, and you have witnessed or experienced any kind of loss of home, displacement, that's going to resonate. And I think that resonates with most people because we're all vulnerable to, you know, forces of nature that can just wipe out everything we've ever
Yeah.
had. So those dramatic examples that people relate to engender more empathy.
Mm. It's a really interesting example. So in the UK, we had lots of terrible images online, on the traditional media, newspaper, and television about the fires in Los Angeles, and I spent quite a bit of time over there, so I almost recognise some of the streets and the towns' structure, and people feel akin to the towns and people around here. But if I see a fire that's uh, in a country with a very low level of GDP, where the towns and cities don't look like my towns and cities, even though it's still a fire and homes are still being destroyed, I turn the page more quickly. And that sounds really cool and cold and callous, but it's because I can't think, my goodness, I've met somebody that lives in those streets. I've been to that park. I've walked on that seashore, whereas I haven't been to that part of Bangladesh, that part of Pakistan, or whatever. So, like as you said, like even though it's the same event, my ability to empathize and feel for it does seem to be quite different.
Well, that's actually a very, very important point you're just making, which is the more we can imagine what it would be like for us, or we resonate with the pain we're seeing because there's mapping on our brain of like, oh yeah, I live in a place like that, or I've been on those streets. That resonance is very powerful. And I think this is one of the biggest challenges to empathy today,
Mm.
is when people are losing the ability to really see other humans as people who are experiencing pain and suffering who are not like them. And it is one of the biggest challenges, in business and in healthcare and in education, or any industry you're in, is that the less we can identify with people, the greater opportunity is to learn about them and to sort of open that curiosity, because these are all humans. They're all
Yes.
people, right?
It's very interesting. I'm doing some study now looking at the effects of empathy or not on climate change mitigation. And a lot of that research exactly echoes what you've been saying. So typically, in a very broad brush, the sort of northern hemisphere tends to be more accountable for some of the climate change issues we see, and the southern hemisphere seems to be the ones that suffer in very, very broad brush terms. But we in the northern hemisphere that perhaps are causing it feel less of an affinity with people in Southeast Asia, etc., where the high levels of seawater and all this, because we just don't. It doesn't resonate. If it's the next state along, it's very, very different. So exactly that. So the ability to and the importance of learning about different people, societies, whatever, and recognizing them as same as opposed to other, I think it must be super important. I should have asked actually one of the first questions is how would you define empathy?
So empathy is a capacity. It's not one thing.
Mhm.
Empathy is our ability to perceive the emotions of others, to process them, and to motivate us to help. So it really takes uh, perception and curiosity to actually perceive a person and are they okay or are they not okay. And empathy is the internal experience of somebody else's emotion that then motivates us to either express compassion if they're suffering or express delight if they're experiencing joy. But it is a very interconnected capacity that allows us temporarily to feel other people's emotions. And that is an extremely sophisticated ability when you think about it, that
Mm,
your feelings transiently hit my brain. So I have a sense of what you're feeling that helps me to respond. It also involves perspective taking. So, what I just described before was emotional empathy, which is part of the capacity. The next is cognitive empathy. And that's our ability to think about what is this person going through? You know, what is their background? Why is this hitting them in this particular way? And so the capacity of empathy is both perception and a cognitive curiosity, and it involves motivation, because we all know we can feel for others, but we don't always do something about it. Sometimes we can't, sometimes we're too busy. And very importantly, empathy also requires the ability to distinguish between the other person's feelings and ours so that we don't get flooded, you know,
mm,
because some people have too much empathy where they can't distinguish between somebody else's upset and their own. So
mm.
these are different parts of the brain that do each of these things.
So is it the intent to act upon the understanding where it differs from sympathy?
Sympathy is included in that capacity. Sympathy is um, sort of acknowledging that somebody's in pain, feeling bad for people. That's how that word has
Yeah.
evolved. Feel bad for him. His favorite dog died. Whereas empathy is feeling with, because we're actually getting a hit of that person's emotion.
Mm,
So if you told me your dog died and my dog died a year ago, and I know the grief, I would probably be feeling more with than just feeling bad for you.
mhm. And I'm not sure whether we can answer this one, but is empathy something that's innate within us, or is it something we need to learn?
So the capacity for empathy, this ability to perceive emotions and then, you know, be motivated to address them, is inborn. but it
Okay.
also needs to be cultivated.
Hmm.
So there is a low percentage of the population that is missing some of the neural mechanisms, like mirror neurons, that actually do this mapping of other people's emotions on our brain. Some people are missing those, and those are what we would call psychopaths or sociopaths who really cannot feel the pain of others or may even take pleasure in causing pain. But the rest of us fall into this broad spectrum where some people are very high on empathy and others much lower. But empathy is can really be modeled in childhood. And so parents who will talk to their children who come home and say, I hate my friend, like instead of just saying, oh, what did your terrible friend do? You might say, oh, what happened? And then say, what do you think is going on for your friend?
Yeah.
Often if a friend starts behaving in a in a un, a harmful way, there's something really upset within that person. So parents can teach their children to have curiosity about, well, what's going on in the other person. Maybe it's not just what they did to you that day, and some examples are like, oh well, you know his mother died like a few months ago, and
Yeah.
now he's being really mean. So it helps the child understand this is really not so much about you, but about the way this child is expressing grief. Also,
Mm.
when there are communities going through like what's happening in Los Angeles, you know, if parents are showing like, let's you know take some food to these people, or let's give them some shelter. These examples are very powerful, in childhood, to see that it really matters to take care of other people.
Mm. So, so from the sort of academic work that you've done and the positions you've reached, so what was it that motivated you to found Empathetics Inc. And how does that make empathy training scalable and relevant for healthcare professionals?
So, when I was doing all of this empathy research, in my role as a Harvard professor and a psychiatrist at Mass General Hospital, um, I had no intent to start a company. I was just following my curiosity. I had a wonderful team of co researchers, and we were really trying to answer the question, can you teach this?
Hmm.
Because all of us in my research group also had clinical practices, and we were all noticing that our patients were feeling unseen, unheard, their concerns were dismissed, and they were getting quite upset with their healthcare providers. So that was very disturbing to me, because we're there to help people, and when you hear these stories, you just think this is actually causing serious harm. So when our research showed through this randomized controlled trial and many pilot studies that empathy can be taught, I developed a training. We tested it in a very rigorous study, and the doctors who got the training got much higher ratings from their patients on their capacity to listen, to show compassion, to hear their story, and to really be curious and caring. And those who hadn't gotten the training got low scores. So we realized this is something we can teach. So once that paper got published, I was asked to present this research literally all over the world. And at one point, I realized I just can't scale myself enough.
Mm.
We need to put this training into some kind of scalable form because everybody wants it. And so that's when uh, uh, an e learning um, executive approached me and said, I think you should put this into an online format, this training. And it was a hard decision because I knew it would take some time away from what I was doing in my academic and clinical work. but it did feel like a calling. It felt like something I needed to do. And it has not been an easy road. Forming a company, it has many challenges and also many rewards. I get to work with wonderful people who want to scale this up and are deeply committed to it.
Would would most healthcare professionals believe they are very empathetic, or are some aware that they? I'm used to call it in the UK like a doctor's bedside manner. So
Mhm.
what? So they might. What were they? How could they explain things? What were they like? How human were they? I guess might be another way of putting it. So, but is there general awareness that actually, yeah, we could be trained on this and learn more about it?
That's a good question, Andrew, because uh, years ago there was more defensiveness around this. Like, what do you mean? I'm empathetic. I'm nice to my patients. Now the level of burnout, not
Yeah.
just in the United States but globally,
Mm.
is so high in healthcare workers, largely due to the stress of the pandemic. But even before that, there were so many challenges in delivering care because of the documentation, the electronic health record,
Yeah.
so much that pulls doctors and nurses away from delivering the patient care and more about documenting everything. That burnout was already brewing before the pandemic, but the pandemic pretty much ripped the mask off of it. And now people acknowledge I'm not the same. I'm not giving the care I want. I feel so burdened, and people now are more interested in beefing up these skills because they want to deliver good care. So there's greater awareness of the lack today than there was years ago.
Which is very good. I do think that, yeah, the pandemic, I know in America and the UK, lots of countries, it did really challenge how healthcare was delivered and the capacity people had. And we've had lots of doctors leaving the profession over here, and we have a dearth of people being trained, etc. And it's really challenging, and it is an incredibly difficult profession in that space. And I think for people to be, yeah, to be engaged in, because I think if you're giving empathy, there's also a benefit to you as the person giving the empathy. So yes, you're being empathic to that individual person or that person's family, but I think it has a positive impact on you as the empathy giver, if that makes sense.
Oh, absolutely. The giver, if they have time and space, absolutely gets a hit of gratitude, and it's I call it the empathy loop. When
Mhm.
we show it, we also receive it. I want to come back to what you just said a few minutes ago about how many professionals are leaving the profession. They're not just
Mm.
leaving their jobs, they're
Mm.
quitting being a doctor and a nurse. Uh, One of the most rewarding parts of our empathy training is that some of our medical partners, so the medical groups, the hospitals, have been measuring the impact of our training on burnout, on employee experience, and on turnover. And in one pretty large study, they showed that there was an 18 times greater retention rate if people took empathetics training versus those who didn't. And so this translates to actually millions of dollars saved, because in a conservative estimate, it takes about $1 million to replace a doctor if they quit. And if it's a surgeon or if it's a specialist, it could
Mm.
be up to 3 to 5 million. So if we conservatively say $1 million to replace a doctor, and we saved 18%, we saved this one medical group $18 million in not having to hire new people. So the more the company is able to partner with healthcare institutions who are doing research and measuring the impact, actually, the more exciting it is that this is not just a nice to have, and it's not just being nice at the bedside. It's really having an impact on whether people want to stay in this job. So the empathy is actually coming back to the providers in learning how to be more empathetic. So I'm sorry, go ahead.
No, no, no. I was going to say that that's so powerful, and I often talk to people on this, and they talk about empathy. It's very good, and yes, we should be more empathic, and we should really focus on empathy. But when you want to look at sometimes you need to look at the hard metrics, and when you've got that, that's almost your one slide is look, there's 18 times. Okay, that's it. Where do we start? Because I think the benefit is not only to the hospital or the medical center or whatever, it's to the person themselves as well. Because people that train to be doctors in particular, it's expensive for them. They're taking out loans, they've got to pay them back, all those things. So actually helping people find a way to stay in their profession is so valuable to that individual and to their patients, of course, and to the medical facility. So it's really good to hear the data behind the research that's gone into it.
It's very exciting data.
Hmm.
One of our healthcare organization CEOs said empathetics is a wellness tool that improves the patient experience. So he really identified that when the healthcare workers feel better and feel more well, it translates to a better patient experience. And part of that is that during the pandemic, I designed a self empathy course. And many people think that's a contradiction in terms. Like, isn't self empathy selfish or isn't it narcissistic? But we all know you cannot pour water from an empty pitcher. And if we are depleted internally of self care, getting proper nutrition, exercise, rest, sleep, and time to, be with friends, we are sequentially becoming less and less empathic because we don't have anything inside to give. And that in the workplace, and this is for your 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 business people and anyone, not just in healthcare. Um, when we prioritize the self care of our employees, we also improve cooperation, collaboration, reciprocity, trust, like all the things that make being at work more enjoyable and more fun. If you have colleagues that want to help, or you say, let's get together and figure that out together. So, when in developing empathy, you're actually developing much better team dynamics. You're developing a sense of belonging, like we're in this together. And so when you say what's the definition, you can see it has such a broad impact, just because we're paying attention not only to how other people feel, but to how we feel.
Yeah, definitely. No, I think the benefits are so powerful, and the more we can demonstrate it, the better. It's like if you can increase retention across whatever business type, if you can increase satisfaction, and I would think that if the patient experience is more positive as viewed by the patient, then potentially their clinical outcomes are more positive, because they believe and trust and respect and feel valued by the medical specialists that is working with them. Then it's going to put them in a more positive mindset, and I'm sure all of that has a benefit to play on the results of whatever treatment they're having.
I think the word respect is absolutely key, because if we are seeing people and listening to them,
Mhm.
they feel like they are a whole person in our eyes. And then they'll tell us more things. They
Yeah,
will trust us. And, many patients withhold information because they're ashamed of how much they're drinking or smoking or not exercising or all the things
yeah,
they know they should be doing. With trust, you can actually get to what's getting in the way of doing these things? Let's do
Mhm.
this piecemeal, one at a time.
Mm. So if you weren't busy enough, you also wrote the book The Empathy Effect, which outlines 7 neuroscience-based keys to improving relationships. And we all want and should want to keep working at relationships. Are there one or two in particular that you think people would find transformative?
Well, the empathy, um, it's an acronym. And I think I would start with the E, which is just make good eye contact with
Mhm.
people, being seen, and not just doing a cursory shake hands but don't look people in the eye. And I know in some cultures it's considered rude to look you directly in the eye, and I'm not saying to do this if it's culturally unacceptable, but whatever you do to acknowledge that you have acknowledged that person's personhood is the key to starting. And then obviously, our training provides facial expression decoding, knowing how to read a face. Is that person sad, or is that person angry, or are they disgusted? There are ways to learn how to read faces accurately, which we provide in our training. And I think one of the most powerful keys in the empathy acronym is the why, which is your reaction. And it doesn't mean what you say, it means what is your physical reaction to this person? Are you feeling calm and relaxed and, in sync?
Mhm.
Or are you feeling turbulence? Are you feeling some kind of, you know, discordance? Because most feelings are mutual. And if we're feeling annoyed or dysregulated, most of the time that person is too. And when we are focusing only on our own irritation or annoyance, we are out of empathy. We are out of the empathic stance. But if we take the why, your reaction, and actually think about what could that person be feeling, and then show some curiosity, maybe we get to actually resolving a conflict that both people are holding.
Yes, don't they often say that you can't control an event, but you can control how you react to the event. So whether it's I used to be a very impatient driver. So if anybody was cut me up or was slow, I would go get very not road rage, but I would get very frustrated and hold that anger for a little while. My daughter's learning to drive now, and being in the car with her just gives me more empathy for people driving and for other drivers on the road. And I do think it's sometimes those really small things that you can drive to work, you're feeling really angry, and you're going into work feeling very negative, and then your whole day is. But thinking, actually, no, if that person goes in front of me, it's 5 more seconds. I'm going to be okay. And yeah, it makes people smile a little bit. One of the things that concerns me so I've got a 14-year-old son and a 17-year-old daughter. Both are fabulous, but like many other teenagers, they spend a lot of time on their phones. Like many adults, spend a lot of time on their phones. And I sometimes feel that even though technologically we have the ability to connect with anybody across the world, you're in Boston today, I'm in London, we're connecting very easily. We're talking, we're looking at each other. But with that ability, sometimes feels that we're losing the volume of human one-to-one contact that we had or have had traditionally. And I just wonder whether that potentially has a negative impact on empathy.
Well, it's a double edged sword, right?
Okay. Hmm.
Because in many ways, technology, as you say, is connecting us more broadly than ever. But I think you're absolutely right that if we're just texting emojis to sort of convey an emotion, or texting, I mean, I hear stories that their kids in the back seat, they're texting each other instead of talking.
I mean, it's astounding, isn't it? But yes,
And
absolutely.
they
My,
are
my daughter texted my son who was upstairs this week, and I explain why that wasn't appropriate. But yeah, extraordinary.
Well, I think we're losing the ability to perceive the emotions of others because our human face is a roadmap of emotion. It's really the only part of our body we don't routinely cover up,
Hmm.
right? And it is the way our species has survived because by, making facial expressions like this, which is an expression of disgust, you're actually alerting a whole bunch of people that the food might be rotten, right? And so even before there was human language, there were facial expressions to communicate very important things about safety, which is why reading facial expressions correctly is so vital. Um, and obviously, all the other nonverbal ways we communicate are
Mhm.
included in that. But if we're always like looking at our phones and not looking at people, we're missing out on so many nuances. Like, does this person just need a thumbs up emoji? Or does this person need a phone call? Or does this person need me to come over? Like, it's very hard to know when they say not doing so great or like having a good day. Like, what do we do with that?
Yeah, and I think there's some research that shows that young adults are starting relationships much later. We've got certainly in the UK, and I know I've seen some research in the US. There's an increased propensity for loneliness, and people find it harder to have those direct conversations because naturally you would if it's been like in Victorian times when you can only write a letter to somebody and never saw them face to face till you actually going to get betrothed or whatever. It's similar now that we message backwards and forwards and it's emojis and you're trying to interpret what somebody's saying and trying to interpret the messaging and then from that trying to almost imagine well what would a physical meeting be like, and it's very different. And I've been in corporates for a long time, and the phone hardly rings now. My first job, phones around the office never stop ringing, whereas now everybody messages. It's not. People find it sometimes hard to pick up the phone and have a dialogue, have a conversation. It
It's
is a bit
actually
of a gap.
considered an intrusion if people just
Yes,
start calling without saying, "Are you available?"
I
Right?
need you text to say, "Are you free for a phone call?" We never used to do that. It's I can't imagine ever. Well, my grandma never had a mobile phone, but texting her and saying, "Is it okay to call my grandma?" It's very very odd. But there are absolute massive positives with technology, like your e-learning platform enabled by technology. Hopefully, we'll see AI start to develop different tools and techniques around empathy. So I talked to a professor in Germany. He'd been doing some work on utilizing AI to map human expressions, like you're talking about, in terms of training people on people. And they were getting to a 90% accuracy in looking at 25 different facial expressions from a quarter of a second interaction. So the AI could recognize whether somebody was sad, depressed, morose, whatever. And yes, there were mistakes, but we make mistakes as humans, I think. So I think there's potentially, you'll know far more than me, a role for AI to play in some of the care end of healthcare. So my mum sadly died of dementia about 18 months ago. And one of the things I always found must have been difficult was when a person with dementia can tend to ask the same question 20 times in a row. And but actually, I think there may be some way of creating some sort of maybe AI interface that doesn't mind answering the same question 20 times. So I do think AI has got, I hope, a positive role to play in healthcare. Is it something that you're seeing talked about more and more?
What I see more and what I can relate to better is ways that AI can relieve administrative
Yeah.
burdens. So having a virtual scribe,
Yes.
where the interaction AI is recording what are the real medical issues happening here.
Mhm.
And it can be emotional too, like if somebody says I'm depressed and so on, so that the doctor does not have to then go and dictate a whole note or type something into the electronic health record, but can just check over what the virtual scribe has done. There's so many new platforms that help people register for a visit, without
Yeah.
having to call and be put on hold. I mean, I think part of this is the population of the world has just grown and grown. And so there are more people needing to, you know, make calls and make appointments than a human being can answer in one day. So these sort of technical solutions, I think everyone in healthcare is looking for ways to relieve administrative burdens that have nothing to do with delivering the care. And I'm very hopeful that we will get back to a more humane and interpersonal and person centered way of interacting with patients
Mhm.
than, having people staring at a computer and typing and saying, "How's the shortness of breath? Any chest pain?" And just
Yeah.
not even looking at the person that they're talking to. It makes a person feel like an object.
Well, it creates a physical barrier. So you are not having that eye contact because the person, the doctor, not their fault, they've got to capture in some way. But so whenever I've talked to people on the podcast that are either interestingly, healthcare and education, the one biggest driver that challenges them and makes them want to reconsider is the amount of non-education and non-healthcare they're being asked to do. So at the end of the day, for a teacher, teachers finish at 3 o'clock. Yeah, no. And they have 3 hours a day of administration. For doctors, and sometimes I talked to a doctor that ran a number of practices, had a number of businesses, and he's saying it could be 40% of the time is spent on administration. I didn't go to university, college, learn all these extra skills, etc., to be an administrator. Not that there's anything wrong with it, being an administrator, but
Well, it should be another person's job. Like
it
that's the
should, yeah.
problem.
Or AI, as I think it should be used, is AI is an assist to us. I don't think
Right.
AI is necessarily going to replace individual jobs and people, but it will replace some of the repetitive tasks that we're asked to do. So the example I always give, so when I first started work, I worked at a big department store, and there was a typing pool of 40, and it was all ladies, 40 ladies. So you wrote a letter on a piece of paper with carbon between it, took it to them. You get the letter about 3 days later, and then you send it out. You can't imagine a business now hiring a typing pool of 40 people to type up letters, because we do it on email, on whatever we do. So those things happen and they evolve, and people are then able to do different things, and they become PAs and EAs and assistants, and yeah, things that are much different, and things that are much more supportive. So just a couple more questions for you, if that's okay. It's one of those silly questions, but if there's one piece of advice you can give to listeners about cultivating more empathy in their daily lives, what would it be?
I think that given how stressed and burdened so many people feel today, especially in education, healthcare, and business, I think the first piece of advice I would give is cultivate some self empathy.
Mhm.
Really tune into yourself. Look in the mirror and look at yourself and say, what do I need? And what can I shed? What can I get rid of? What's really just mine to do? Um, because when we are that stressed and burdened, it's very hard to have enough left over to be empathic to others. But I think at the same time, recognizing that every human being in your classroom, in your department, your division or in your practice is a human being with their own sets of fears, longings, desires, competing, events in their lives, that everyone's got their head full of the same kinds of things that we're walking around with.
Yeah,
And sharing a little kindness and just checking in, saying, "How are you doing?" People know that you don't have 45 minutes to listen to them, but just check in. And if someone is really in pain, you know see if they need someone to talk to, or see if they need to see somebody. It could be a chaplain, whatever the role is, but um, just be aware of people who are suffering, because all of us, I guess, are suffering to some degree, but some are suffering so much more. And to ignore that is at everyone's peril.
Yeah. Two points on that. So when you mentioned chaplains, so I spoke to a lady chaplain in the British Army. She's a chaplain to the bomb squad in the British Army. She's a fascinating person, got quite young and just ended up somehow in this role. And I asked her, so how can you show empathy, understanding, support for families that may have been through difficult times or soldiers, or what do you do? And she said, well, the biggest thing I do is to let them know I'm holding space for them and listening, basically. Which is what you said, that yes, you might not have 45 minutes, but if you're going to ask somebody a question about how they're feeling, just give them the listen for that minute. Don't ask it and then as you're walking away, ask it and then listen. And then the second one was about self empathy, which I think sometimes people feel guilty for, but I always liken it to the announcement on the aeroplane. So when the oxygen masks fall, put your own mask on first, then help somebody else. Because if I can't do my mask up, then I can't help my children. Whereas your natural inclination is to help your children, your partner, or whatever. You've got to make sure you're okay and ready to do that. Which leads on to the final question, I guess, is so I'm not quite sure how you manage it, but you spend a lot of time working. You invest a huge amount of time, and it's obvious your passion for what you do. But how do you make sure you look after your own mental and physical well-being? How are you in the best place possible to work with people?
Well, it is sometimes not easy. I have a lot of responsibilities, and I'm just going to, as part of the answer, the last chapter in my book is called Self Empathy,
Mhm.
because it came to me as I was writing the book that, it can't just be all about output, it also has to be about input. And if I were to write that book again or the next edition, I would put self empathy first,
First chapter. Okay.
because I too have been more inclined as a psychiatrist, a mother, a member of the empathetics business, very geared toward doing my jobs, getting things done. And it is challenging to prioritize your self care. And so part of my learning was building a team so that one person can't do it all. And you have to have people you're working with. If you're a parent, remember, maybe your 10-year-old can unload the dishwasher. Like, you don't have to be doing everything yourself. So part of how I rejuvenate is I've learned that spending more time with family and friends, being in nature, for me especially, exercising in nature, hiking,
Mhm.
skiing, kayaking, things that where I really can't be doing any other thing because I'm fully occupied. Those things really help me to refuel. And so I guess my big advice is figure out, for me, listening to music. I was a music major in college, and my piano playing has really gone fallow, but like, think about what brings you joy and do a little
Yeah.
bit of it. And so these are challenges for most busy people.
That was perfect. I think that's a great place to end. Thank you so much for your time. I was inspired and I feel like I could easily go on for another few hours. But thank you so much for joining us.
It was my pleasure.